It is just a huge honor for me today to be podcast interviewing Dr. Ashley Stein, NMD, is a board-certified naturopathic medical doctor right here in Ahwatukee. She received her Bachelor of Science in Biomedical Engineering at Boston University, but quickly learned that medicine is much more than surgeries and pharmaceuticals. Growing up loving both nature and medicine, she went on to attend medical school in Arizona, where she earned Doctorate of Naturopathic Medicine at SCNM. Dr. Stein loves to treat the whole person and strives to find the root cause of every patient's condition. She incorporates evidence-based medicine with ancient wisdom to provide an individualized health plan, helping you not only get well, but also provide the right tools to continue to thrive and optimize your longevity. With a health focus in pain management, Dr. Stein provides the clinic's regenerative therapies, including Prolotherapy, Perineural Therapy, PRP, as well as IV injection therapies like vitamin therapy, chelation, immune support. Prevention is the best medicine. Together, she will work with you to accomplish your health goals and become the healthiest version of yourself. Dr. Stein treats all conditions with modern and natural alternatives, such as nutrition, acupuncture, and botanicals, and many more modalities. When she's not in the office, she likes to spend her free time rock climbing, playing guitar, hiking, and traveling to Lake Tahoe. Why Lake Tahoe?
I'm from Reno, Nevada, so I grew up there.
Oh, wow. And you know what? When I opened up in 87, starting in 1990, I started lecturing to dentists all around the world from 30 to,
Wow.
from 1990 to now. I've given over 1,000 lectures in 50 countries, and
Wow.
I see the parallel of Lake Tahoe to what's happening now in Flag. So the first time I lectured in
Yeah.
Tahoe, it was this little hillbilly town and these little $100,000. I mean, when I was there, I was charcoaling with a dentist who had like a $150,000 home on the lake. And then
Yeah.
out of nowhere, everybody in San Fran figured out, oh my God, we can get out of this damn city. Now, how far is the
Mhm.
drive from Tahoe to San Fran?
Oh, 4 hours?
Yeah, and they're
Depends
like,
on what side, yeah.
yeah, it's like 4 hours. I can get the hell out of here. And my
Mhm.
gosh, I've seen this due to the pandemic and people are flying around the world. I've seen houses up north literally double in value
Oh,
in
yeah.
since this pandemic started. And I've gone up there with the Airbnbs, and
Mhm.
now my wife's like, "We need a house up there," and I'm like, "Okay, that turned out to be a very expensive vacation." So how is it? How was it switching from Tahoe to the desert?
It wasn't too bad because Tahoe, well, Reno, Tahoe's like we call it high desert, high Sierra desert. So it's pretty dry up there too, but we get snow. I like the desert though because lots of sun, lots of warmth. I'm a sun person, so when I went to school in Boston, that was a whole other chunk of my life that was in mostly the dark and the clouds. So transitioning here was actually just pretty obvious. I always wanted to live in Arizona where there was more sun than snow.
Well, you just walked into the proverbial sliding glass door with that question saying that you love sun, because a lot of people have get conflicting advice from their doctors right here in Ahwatukee. You got the dermatologist saying, stay out of it, don't go out from 10 to 3, especially me because I'm Irish, fair skin, freckles. And then you have other doctors saying, oh no, you need the vitamin D, you need the D3, you
Hmm.
need all the vitamin D. So which one is it,
Yeah.
sun or no sun?
Again, it's going to depend upon you and if you have a predisposition for skin cancer or you have current skin cancer, of course. So talk to your doctor first. But I am a big proponent of sun. So I think the recommendation is you can get 20 minutes of direct sunlight a day without any sun protection. So I find a lot of people in Arizona are vitamin D deficient. Pretty much everybody. I run a vitamin D lab and I have to give them supplements. So if you can get some of that from sun, it's going to help that process a lot better. I think just getting outside too, especially nowadays, mental health. I think it's really important to get some fresh air, some sun for at least 20 minutes.
I gave up on mental health years ago. I think it's highly overrated, and I may be insane, but I'm enjoying myself. Is that what all this matter? You know, it's funny.
Yeah.
I've gone full circle. When I was when I got at dental school, it was 1987. Please don't tell me that you weren't born in '87. Were you? Were you even born? Oh my gosh, you just ruined my whole day. But it was so funny because back then, when you're a formally trained dentist, anybody who's not following the gospel according to dentistry was a holistic naturopath.
Mhm.
Get in line. These are rebels. And then I watched the journey. Now I'm going to turn 59 this year, and all my hardcore conservative dentist colleagues who didn't want to hear anything about, exactly the protocol taught in dental school. I noticed that when they get high blood pressure, they don't go take a
Mhm.
pharmaceutical. They
Mhm.
call a nutritionist. They get a trainer. And it's so funny because then I'll sit there and say, man, you're not turning into one of those holistic naturopath people, are you? I mean, the cure to high blood pressure is at Walgreens. And it's really interesting how I have witnessed when I got out of school that the people just had blind faith, and you would tell them what they need, and they say, well, you're the
Yeah.
doctor. And now the iPhone's out and they got
Right.
Google, and they're like, no, I don't want to take a pill every time something's wrong. So
Mhm.
I see a massive shift going from follow the doctor's order, take your Walgreens CVS pill, to now
Mhm.
self mastery. Like, well, what can I do to change my diet, sleep, whatever? Are you seeing this trend?
Right, definitely. I think also with having Google and more resources for people to learn about their disease, they are more educated about it. So they're less likely to just take the pill that someone gives them, a doctor gives them for whatever they come in for. I think in Arizona, especially, this is a big trend. Naturopathic doctors have the widest scope of practice here. So there's a lot of us here. We can do more with the patient, right? So, and yeah, the health industry is really rapidly changing, and the demand for naturopathic alternative medicine is really high. And I hope that it can spread, throughout the U.S. Not every state is licensed to do this medicine. So, luckily, with telemedicine, I've been able to reach a lot of people in different states. But yeah, I think the health revolution is going to be more at finding the root cause and treating the root cause than taking a medication to help the symptoms, so to speak.
Absolutely. And I got to be careful what I say for hip and everything, but one of my very best friends has rheumatism, and she
Mhm.
just got it out of nowhere. I mean, like a year ago, and the doctors wanted to put her on like a methyltrexate, and she's reading all this stuff, and I mean, it just scared the hell out of her. So she
Yeah.
immediately started Googling and studying, and I've been really impressed with how much she's learned. I mean, she's it's just amazing. Um,
Yeah.
but the reason I don't want our listeners to go read about diseases on Google is because you might have the same problem I do. Which is no matter what disease you read about, you start thinking, well, hell, maybe I got that disease. I mean, some of those symptoms are so vague. Um,
Yeah.
so what's it like so people who have never been to a naturopathic doctor, do you mainly see elderly? Is it middle age? Is it young? Is it certain diseases go there more than others? What is your life like?
Well, my life, I think I see pretty much all of it. I focus in more like regenerative medicine, we'll talk about later, but we can see anywhere from pediatrics to geriatrics to we do women's health, um, we see a lot of other specialty diseases. So, nephrology, and we have liver patients coming in, cancer patients, pretty much any disease process we can do something about. Um, so I pretty much see it all right now. And I guess, again, I do a lot of telemedicine too. So I do a lot of like nutrition counseling, lifestyle changes. Um, but in the clinic, I do a lot of more hands-on therapies. So like acupuncture and IVs and things like that. So yeah, I'm seeing a wide range of everybody right now. A lot of mental health right now too.
You know, so many people, when you study the history, some leader gave them a mission, called them for their service, and they rose to the occasion. And a lot of people think that during this pandemic, that there should have been more emphasis on, hey, maybe this is time for you to get more healthy. I mean, it's a respiratory disease.
Hmm.
It'd be a good time to quit vaping and smoking and
Right.
doping and all that. Bill Maher talks about that a lot. He's like, if you would spend more time just trying to get healthy as opposed to more time just hiding in the bunker basement. But I really like this telemedicine thing. My mom's 82, and
Mm-hmm.
I love it because it used to scare me when she'd drive 30 minutes across
Right.
town to an appointment, which I know, the driving part of her appointment kills 36,000 Americans a year. So it's
Right.
kind of weird to risk being one of those 36,000 casualties to go get healthier at the
Mm-hmm.
doctor. And now she's on her iPad and
Yeah.
does her doctor. Are you doing much telemedicine?
Yeah, I'm doing a lot of telemedicine. I have a couple days a week where I see patients again from all over the place, all over the US. So it's been really fun.
Seriously.
Just, yeah, to be able to share naturopathic medicine in states that don't even have it yet. So,
So
yeah.
how do those people find you? Just the internet?
Yeah, I actually am on like a clinic group called ND Consult Live. So that's my virtual clinic, you could say, with a couple other practitioners, and we service anywhere. Some of the doctors on there can service people in states that they're licensed in. I'm only licensed in Arizona, but I'm still seeing patients everywhere. It's just like a little bit. It's more like a wellness visit, so we can't actually prescribe for people, but a lot of times their doctor isn't going over wellness with them. They're not going over lifestyle changes or supplements. I do a lot of supplement managing. So they're just really thankful to have that option now. And I think with the telemedicine revolution now, it's just so easy to get the help that you need.
Wow, I'm on your site now, ND Consult Live. And
Mm-hmm.
my gosh, wow. And are these or are you the only one from Arizona?
Where there's a couple people, I think, from out of state. There's an East Coast doc, I think, but most of us have graduated here from Arizona, and most of us are still in Arizona. Correct.
So it's called ND Consult Live. I'm just curious, why not NMD Consult Live?
I'm not really sure, actually. I think legally in other states we are ND, so I think we just wanted to cover our bases there since we're reaching the whole country. In Arizona, you can call yourself an NMD.
Oh, I see. Naturopathic medical doctor versus
Right. Naturopathic doctor.
naturopathic doctor, and
Right.
it's embarrassing for me because there's some of the dental schools give you a DDS and
Mm-hmm.
some give you a DMD, and there's
Mm-hmm.
zero difference in any curriculum
Right.
and no and but we have to answer this question. I mean, I've been answering this question for 32 years, and it's like, why can't the American Dental Association? It's called standards. Why can't they create a standard to say, hey, maybe we should stop confusing?
Right.
And and it's a valid question. I mean,
Yeah, well, that's what we're hoping is eventually the whole country will unite under one degree as well, one regulation to one regulating body. Because right now each state has a different set of rules for naturopathic doctors, so that's also a whole nother ball game. So hopefully here soon we'll have everybody all on the same page in every state.
Yeah, that is so cool. So I want to go back to this ND Consultative Life because I know Awatuki is a complex city. When I got here in '87, it was basically it was a retirement community built by Presley, and my gosh, my practice I was all senior citizens. But
Yeah.
as it went south and then deeper into the foothills, it turned into the full spectrum. But there are I still view Awatuki from like 48th and Elliott, like a mile around that is just a retirement community.
Right.
And so I'm sure they're big fans of the show. I'm sure they would love to hear more about this ND Consult Live. So
Yeah.
first thing they're thinking is you go to the website, it says schedule your appointment, and then you.
Yep. And you just schedule a new patient visit. And then we talk for about an hour going over your whole health history. And it will send you new patient paperwork. So just like a normal doctor's visit. And we'll go over it. And, if you are local, I encourage you to come into the clinic. We can meet each other, and we're doing, COVID regulations here. So with masks and everything. But if there's for whatever reason, if you are immunocompromised, definitely stay home. So we'll do a new patient visit, and we just go from there. We can order lab work, get you on the right supplements. Again, if you're in Arizona, we can do medications if we need to. But it's really nice because I got a lot of people coming to me with like specialist records, so labs that have already been done or scans, and then we can just kind of take it to the next level. If they come to me and they don't want to be on the medication that their doctor gave them, and we can do some other things. But so yeah, I get a lot of like second opinions, you could say.
And I'll tell you what, the doctor never gets the true story on the medication. I mean, I know people who go get their medication, they get it filled because they know it's supposed to, but they don't believe in it and they don't take them. I mean, how many times have you gone to your own moms or aunts or uncles and you open up their kitchen cabinet looking for a cup and there's like 100 prescription bottles and they're all still full and
Right.
they're 5 years old. It's like, what, So do you think it's because it's my theory that with the elderly, they were raised in a culture of you just okay, and if you disagree with the doctor, well, you're certainly not going to tell them. Whereas a millennial, they'll argue with you all day long. So it's really tough to figure out what these people are doing behind closed doors.
Definitely. It's definitely something we learn in med school too, to be aware of that. A lot of times older individuals don't remember exactly what they're taking, or they'll go to another doctor and then that doctor will prescribe the same thing. And that's called polypharmacy. So now they've got like double prescriptions and they still don't know what they're for. And it's definitely something we are educated on. So we're aware of it because it can become a problem.
So what does that telemedicine appointment cost?
I believe 260, 269. I can't remember what we had to change our prices for whatever reason. We're really growing pretty quickly, so we had to hire some staff actually. And that's the first visit. So pretty much that's the going rate in the Valley, you could say, for new patient visits. I tend to spend a little bit longer with my new patients, so I think it's still a good value.
So do you do that on your iPhone or do you do it on an iPad or how?
I do it on my laptop. Just like this, I'm on my laptop.
Huh.
Yeah.
I think
they can do it on their phones or their iPads, whichever. They just get like a text message, click the link to start talking to your doctor. So they can do it wherever, on the go, if they're running errands. I just have people in their cars all the time.
Okay, well, everybody that I talked to and told them I was podcasting today, the first thing they said, well, ask her about vitamin D3. It's kind of like this pandemic. The fancy guy out of this pandemic was vitamin D3. I mean, he's the superstar. He got his 15 minutes of fame. Is it justified?
Oh yeah, I mean, vitamin D is obviously an essential vitamin, but specifically, it's great, like anti-cancer properties, immune system boosting properties. It affects your mental health. I see a lot of, ironically, Arizonans with vitamin D levels at like 20 or less. You want to be in the like 60 to 80 range. You don't want to be higher than that because you can get to like a toxic level. So make sure you're working with your doctor, of course, before you just go supplementing. But yeah, I think it's when I see people with that low vitamin D, it doesn't matter if they're healthy as a horse, I put them on vitamin D because your body needs it. Your immune system needs it in the background, to fight everything. So yeah, it's one of those things that's become super popular now and all over social media and things like that, as well as glutathione, if you've heard of that. So I definitely think glutathione has been pretty, it's out there in the naturopathic community, at least, as a really good treatment for COVID right now for respiratory issues. Glutathione is a really good antioxidant. So the root of all disease is oxidation and inflammation. So it's just really great a really great nutrient to use for pretty much all disease processes.
So, to a newbie to naturopathic medicine, how does it differ from, say, your conventional MD?
Well, it really depends. Again, in Arizona, we're pretty progressive and using a lot of naturopathic and alternative medicine. So a lot of times the MDs will do a lot of alternative naturopathic modalities as well. But typically we go to school for the same amount of time and we learn the same medicine that they do. We just have a different regulating body and a different licensure. And we learn the regular medicine, but we tend to take it a step further and we learn all of the alternatives. So the nutrition aspect of it. We learn acupuncture, which is its own degree in itself. We learn, mind, body, mental health techniques. IV therapy. We do a lot of IV therapy, botanical medicine. So that's huge because a lot of times good medicine is actually from an herbal source. Tons of other things that are slipping my mind at the moment, but you get the idea. So we do the same medicine and we do alternatives with it. So if we need to prescribe something, absolutely we can. But that's just not our first tool in our toolbox, so to speak. We have other tools.
Being out of school 3 decades, I can't believe how many things that I was formerly taught are now completely wrong. And not just, and I'm not talking dentistry. I'm going all the way back to physics at Creighton University, 1980. Some of the foundations of physics are no longer true. And you're just like, I mean, it seems like things are moving faster. But two things that they never mention in school, and now you just hear it all day long, especially in dentistry, is sleep disorders, sleep apnea, all this kind of stuff like that. And the gut. I mean, the gut microbiome. I mean, I just read a paper the other day. I have a bunch of patients who have autism, and they factually now have traced one gut microbiome bacteria to a cause of autism. And I was reading this one paper, and to me, I'm feigning expertise. I'm a dentist. I'm not an autism person, but the guy's saying, look, you have, they used to say that the human body had 1 trillion cells and your gut microbiome had 10 trillion cells. And of course, the scientists want to trace it backwards. Show me how you figured that out. And it was just an anecdotal comment that someone said. But when they actually went to figure it out, they were saying that, that humans are, what was it about, something like 3.5 billion I think it was 3.5 billion cells, and then your gut microbiome had 3.5 billion bacteria, fungi, eukaryotes. So it's about half and half. So when you look in the mirror, you see everything your mom and dad made, but from your mouth on down, you have a whole nother baby Howie living in your gut. And they're linking it to obesity and diabetes and all this stuff like that.
100%. Yeah.
And so a lot of people are, and Mayo Clinic, if you think this is crazy, the #1 transplant on earth is actually a fecal matter transplant. It's not a kidney and the Mayo Clinic's doing it. So if the Mayo Clinic is doing fecal matter transplants, I think it's now something we should all listen about. And like, so what the hell is a fecal matter transplant? And what do you think, do you think the gut plays as big a role as people are making it out to be?
Oh yeah, 100%. So your gut microbiome. So we are pretty much more bacterial cells than human cells. We're just a reservoir. And your gut microbiome has its own immune system. In fact, I think something like 80% of your immune system is in your gut. So if you don't have a healthy gut, you got problems, right? So it has a mind of its own. The gut-brain connection is a huge thing too. There's studies about, if your gut's not happy, you're not happy. For the fecal transplants, you have to actually be careful. The person who's donating the feces, you want to make sure that they don't have anything like clinical depression or anxiety, because those characteristics can be transplanted into you. So there's obviously a gut microbiome connection to mental health. So I think it's definitely something that needs to be treated. Pretty much in all my patients, I treat the gut. There's not one thing that isn't related to the gut, one disease process, probably all related to the gut because it involves the immune system so much. So we see a lot of that here. We do a lot of reframing that whole situation. You got to get the gut microbiome on track.
Well, I'm very lucky when it comes to gut microbiome because my gut is huge. So it's got to be an Amazon rainforest on there. Not that anyone should listen to Joe Rogan for medical advice, but he was talking to some other person, and they were flying to Hong Kong, and basically was saying that when a newborn baby is born, they cut the placenta, and that placenta blood is like worth like 10 grand to rich people, and they immediately have it put straight into their body for stem cells and all this stuff like that.
Yeah.
And who was that famous Kyle, who's that famous actor that did Patriot and Mel Gibson
Mel
sent his
Gibson.
dad to one of those, and it's really, but it's not like I'm gonna use that as a cure for disease, but I think that 100 years from now, things may look will definitely look very different.
Yeah, stem cells are very hot right now too. We don't even know everything about them. Like research comes out every day about stem cells or amnio products or exosomes, and you can inject XYZ into your veins, into your joints. Typically, with being in the United States with the FDA, we don't have a lot of things that we legally can inject. Again, it's like an evolving field right now, so we can't actually do like stem cells injected in IV intravenous. So a lot of people are going to Hong Kong or Panama has actually a pretty good clinic out there doing that. But yeah, these stem cells from cord blood, from placenta, those are all really amazing products when they're isolated and used appropriately. They can really do a lot to heal a lot of different disease processes, cancer, help regrow liver, inflammation. We use it a lot on joints actually, for regenerative medicine. And that's an evolving field as well. Peptides, all those kinds of things for regenerating joints.
So besides finding someone really healthy to donate their daily fecal matter to be transplanted into me, I'd rather try an alternative approach first. How would someone who thought, well, I would like to have my gut healthier, what would you tell that person? Would you have them switch from Big Macs to Arby's roast beefs, or
yeah, there's
or the regular French fry? Because Arby's got the triangular French fries, and I think those are healthier because they look like geometry. There's got to be science involved in there.
Yeah. Okay. Didn't know that. But yes, there is a wide range of how to heal your gut. There's tons of different things that could be going on with it, and a million different ways people are eating food and what kinds of foods they're eating. So I just start with the basics. First, I have you fill out, if you were my patient, we'd fill out a diet diary. So what are you eating for breakfast, lunch, dinner, snacks for 7 days? Because typically when I ask someone, what do you have usually for dinner? They're going to tell me what their ideal meal is, not what they actually had for dinner last night, which is probably a cheat meal. So I want to look up what you're eating throughout the week. And then we can make diet changes. We can do further testing. I like to look at food allergies. Those are a really big issue I find. I think that we've all been finding with people for whatever reason, just the global health right now, lots of food allergies, lots of inflammation, chronic disease related to it. So I tend to look at those. I test for those. We can even do like stool testing if I feel it's necessary. So if they have like a gut microbiome imbalance, we can do stool testing to see exactly what bacteria are in your gut. But yeah, I start with the basics. So we change a little bit in the diet. If we have to move, if someone's eating fast food for every meal, we say, okay, you can go to McDonald's, but try to get the salad next time. Because, maybe it's because you really don't have enough time to make your meals and it needs to be fast. Salad and Go is a new cool thing out there. Have you seen the Salad and Go?
No, what is a Salad and Go?
They're even cheaper than fast food like McDonald's and things like that. They're popping up everywhere. They're really great because they're like organic salads for really cheap and they're really fast. So I'm really trying to get more of my patients to do that. If truly they don't have enough time to make their own meals, go to Salad and Go. They're popping up everywhere. And I guess they,
Does Ahwatukee have one?
I don't know, but I know I pass a few getting to work every day. There's one out in East.
I never even heard of it before. Salad and Go. We're right around the corner.
There'll be one around the corner. I guarantee it. They're popping up everywhere. And
wow. Yeah. So they got one really Dobson, delicious. Chandler, Gilbert, and Queen Creek.
Yeah. I think their goal is to keep staying below like cheaper than fast food because that's what people are attracted to. They're not only addicted to the food, but the price and how fast it is. So they are really cheap and really fast. And the more they pop up, the more locations they have, the cheaper they become. So that's their goal, is to just stay under, certain price. And people are starting to really love them.
Well, it's
so I encourage my patients to do that.
Yeah, a couple of things. It's you see people like me that'll do the right thing, a healthy salad, but then when they get done putting the blue oh, what's that sauce I like, the croutons and the
Yeah,
blue cheese ranch
blue cheese.
dressing. I mean, then you kind of ruin it.
Yeah,
So how do you go to
definitely.
Salad and Go and not ruin your salad with all that stuff?
That's a good question. Olive oil is always a safe bet. So that's a good point. Is sometimes when I look at someone's food diary, they've got, healthy food choices. They have good intentions, but then they have like sugar dressing and, croutons and cheese and all this stuff. So I like to change the quality of things you're eating too. So if we need to switch to a sugar-free dressing, that's probably going to benefit you more. Or maybe you do need some more high quality fats like olive oil or avocado. Maybe we need to reduce your salt. So I make slow changes like that. We kind of change up brands as well. So to not ruin a salad, I would say stick to olive oil, throw as many veggies as you can on there, mix, and not only eating leaves, but eat like some tomatoes and avocado and olives are good for you too. So you can make a salad pretty flavorful with those things. And of course, throw some protein on there. They have protein options as well.
Well, I'm sure Joel Chrisman, Chief Executive Officer at Salad and Go, is joining our little club. So, Joel, if you're listening, we want to know, when does Awatuki get a Salad and Go? By the way, I got to tell you a really bad story about me personally. In 1987, I rented at 48th Street in LA. It was a Safeway, Plaza, Walgreens, all this, and there was a chicken restaurant, then there was the bank and a Pizza Hut and an empty pad. And then we had the economic meltdown, it was, I forgot what it was called, it was in
Right.
87, it was Black Monday or Black Thursday. And I noticed that lot in front of me went from like 600,000, it plummeted. So I put a bid on it, which is where my office is today. And the guy accepted the bid and all that. And then I got this call from the CEO of Long John Silver's. And he goes, dude, he goes, that's where we want to go. You're a dental office. You don't need to be on a retail pad in a deal.
Mm-hmm.
You can go to any medical dental building. Please, I'll tell you what. I'll bump you. I'll give you a $10,000 or whatever. And I said, no, I'm going to be here for 40 years. And I don't want to pay rent. And this is where I want it. But I feel bad because Awatuki still doesn't have a Long John Silver's. And my gosh, if they knew that I was the cause of it, I'd probably get murdered.
Well, now they do know, so you better be careful.
Oh my God, I love that. And let's be frank. How do you this is my horror story. Guess what my dad's job was when I grew up? Guess what my dad owned?
I'm not sure.
My entire childhood, a Sonic
McDonald's?
drive-in.
Oh, yeah.
And one of his best friends was Dan and Beverly Carney. They were the founders of Pizza Hut in Wichita. In fact, when I opened my dental office, there was a Pizza Hut next to it. So Dan Carney flew out with my dad. It was so great. But I mean, I thought I was the luckiest kid in the world because I had free cheeseburgers, onion rings, and French fries and malts and Coke my whole life. And so now, when you get older, when you're 58, and you're like, when people say, "Well, would you like broccoli?" Well, of course I'd rather have tater tots. I mean, I'm not insane, but how would you coach people to lose those, or what do you call them? Comfort foods, or
Yeah.
what your mama
Yeah.
gave you? I mean, how do
Yeah,
you?
exactly. They're like deep rooted, right?
Yeah,
I mean, it's hard because I've never experienced that, of course. I'm not, 40 years into eating a certain food group or anything. But I mean, we all have that a little bit, unless you're raised by like an amazing grass-fed hippie. We've all had that experience. I mean, I had McDonald's growing up, and I think, all the way until 2014, I was eating sugary cereal for dinner and breakfast. So it's definitely a lifestyle. It's a commitment. It's a commitment to your health, and just acknowledging that that you need to change your diet a little bit, and knowing why, and knowing that your health goals are attainable from diet. Then I think that's square one. So if you're not mentally committed, if you don't actually truly want to help to change your health, then it's not going to happen for you. Doctors can only do so much to get you there. I can give you all the tools. I can tell you exactly what to eat, but it's got to come from within. And I had to do it myself, and it's really hard. And getting off of sugar, getting off of things that you're addicted to, certain foods and brands is really hard. Sugar is more addictive than cocaine. So it's not you. It's unfortunately the foods that our society puts out there that trick you into believing it's food and nutritious. They're the culprits. So
And I'll never forget what Dr. Bernard Butterworth taught us in anatomy class when we were learning nerves about the neurotransmitter being acetylcholine. He says, but I want you to remember, he goes, we're a very late to the party species, but for the
yeah,
first billion years, the only neurotransmitter was sugar. It was glucose. So he says, you have no idea how powerful this stuff is. It speaks
right.
to every cell in your body. And my gosh, it's crazy. Why I don't.
Yeah.
So so do you think? And the other problem I have with nutrition is, I remember when, again, I'm biased by my formal training from dental school 3 decades ago, but our teacher said, I really hate teaching this part now about how to read food labels and all that stuff, because
Oh
she
yeah.
says, if it has a label on it, you shouldn't eat it. She goes, you should eat a plant. There's no food label on a carrot or an orange. She goes, you should eat a chicken, a bird, a turkey, whatever. She says, so here's what I'm going to tell you. If it has a label on it, don't eat it. And I feel like an idiot, she says, that I have to teach you how to read this stuff because I don't even believe in it. So what do you say to people who want to count their calories and count their nutrition and count all that stuff, but still eating out of boxes, cans, and packages in the freezer as
Yeah.
opposed to just eating naturally? I mean, do you think?
I mean, it's really hard, again, to do that in our society because everything, let's just look at the grocery store. There's like 2 aisles of produce and the rest, the 18 other ones are boxes and cans. So it's really difficult to do that nowadays, but I think it's definitely attainable. I absolutely agree. We should be eating more whole foods and things without labels because it's more bioavailable. So you can get more nutrition out of apples and oranges and kale and things like that than like the veggie chips, right? Because they've been processed. So you'll have more energy and you can use your nutrients faster because they're more bioavailable. They haven't been tampered with. Now, that isn't to say that things from a box are completely unhealthy for you, but reading labels is a must. And don't be fooled by the things that have added sugar and, extra salt and extra food coloring and preservatives. Those 100% we don't need to be eating. If it has food coloring, preservatives, we don't need that in our body. So I think there's a balance for sure, because some things, again, from a box could be pretty nutritious, but it's just about, knowing, being knowledgeable of it. Most of us just don't even know what to look at. But if you stick to the general rule of eating a whole food, you're golden.
So, I don't know who has the worst reputation on our dentists or lawyers, but everybody hates us both. It's always open season on us to tease us and all that. But the big thing about dentistry is pain. I mean, people are just afraid of pain. And pain is very debilitating. I mean, not just dental pain or a toothache or whatever, but what can a naturopath, do you see pain? Do you do pain, to talk about pain or pain management?
Yes, I do a lot of pain management. Pretty much everybody experiences chronic pain at some point in their life, unfortunately. I do a lot of, like I said, regenerative injections. So I do pain management. That's what I focused in school. So pain management, regenerative injections, natural options for treating pain. So non-pharmaceutical ways of treating pain. So I see a lot of people coming in who have been on opioids for so many years, or they don't want to take them anymore, or maybe it's not an option for them. And we do a lot of other options for them here. Acupuncture, again, regenerative joint injections, FSM therapy, but specifically with the regenerative joint injections, there's Prolotherapy Prp Therapy. I don't know if you've ever heard of those.
I have not.
Those are stem cell therapy. So they're a very, I said, okay, hot topic, right? Up and coming research on that. So prolotherapy is really great because I can treat, a lot of people have pain related to a musculoskeletal issue. So either joint inflammation or maybe a ligament is too loose and they're having pain from that. And prolotherapy is a really great option to treat those in a more of a semi-permanent way. So instead of taking pain meds or getting like a cortisone shot, I can treat with prolotherapy, and it's a sugar solution. It's just sugar. So again, the bad guy sugar, actually in this case, we use it in a good way. It causes some inflammation. So I can inject it into like an elbow or a knee, and it causes local inflammation, which brings the immune cells to the area to heal the tissues. So sometimes when you have like an old injury, like you tore your MCL in college and now 20 years later, you're having trouble at the gym, running, whatever, that's a really good option, because then you don't need to get the cortisone, the steroid shot, which we all know, hopefully we all know, is not a long-term, is not great long-term, because you tend to need them more and more, and then it becomes degenerative with those. But we can get into that in another podcast. Does that answer a little bit?
And then you also talk about perineural therapy.
Yeah, that's a great one for nerves. You hear the neural, so peri meaning around, and then neural, the nerves. So I inject a very, very low dose sugar solution around nerves where you have nerve pain. So like plantar fasciitis, sometimes diabetic neuropathy, a lot of like bulging disc pain, referred pain from the spine. Trigger points is kind of similar, trigger point therapy. So it kind of just calms and nourishes the nerves in the area. So people can go, I even treat like migraines, the occipital nerve is the cause of migraines. So I have patients go months and months without needing another injection, because they've gotten the nerves have been nourished in the area.
So let's open up the can of worms, the subject we should not talk about, and that is I know a lot of people look at dentistry as this really bad guy, because we did the silver fillings that were half mercury, half silver, copper, zinc, and tin, and it's a metal filling. And we've had them since 1987. I could do one right now, but nobody wants them in Ahwatukee. I mean, I have like one person every other year that wants one in Ahwatukee, but in some parts of the country, it's the main filling, and there's a lot of people that are very, very against it. How do you weigh in on the dentist silver filling?
Yeah, there's definitely plenty of studies that show that mercury is neurotoxic, and that they are in silver fillings. However, most studies
it's only
show
half of it, though. It's only half the filling is mercury. Solid neurotoxic mercury. It's only half, but
solid neurotoxic.
But I did notice they don't put mercury in the multivitamins, so that makes me wonder if it's not as good as people think it is. But anyway, sorry to interrupt.
You don't need mercury in your body at that level. So, I mean, so if that's the only option available, obviously, and they need the filling, that's probably more important than not having the filling. The oral microbiome is a huge issue too. So, but there are good studies that show that actually you are exposed to more mercury during the process of the filling or getting it removed. So after it's done, you actually don't have a lot of leaching into the body of mercury. It's more of the process of putting it in. You're inhaling it, you're absorbing it. And if they remove it, same process, right? So I think that if that's the only option you have, then you need to just work on your body's ability to process toxins. So a lot of us with chronic diseases and things like that, our ability to process toxins goes way down. Your liver is overrun by a lot of other disease processes going on. So you need to just support that. Your body detoxes things all day long, and you just need to give it the right nutrients to support it. So like we talked about, glutathione, really great for a detox support. Another one is NAC, N-acetylcysteine, really great for antioxidation. Vitamin C is a great antioxidant. So you just kind of have to help the body do its process. It can process the mercury and get it out, but most people are pretty, you could say, preoccupied with other disease processes that makes it a little bit more of an issue to detox normally.
So I'm still wondering, what is, if you go to McDonald's, it's a Big Mac, fry, and a Coke. You go to all these, if you go to a dentist, it's a cleaning exam, x-ray, maybe a toothache, an extraction, root canal. What would you say is your equivalent to dentistry, your cleaning exam, x-ray, root canal filling? What does the menu look like for you?
I would say you mean like just a normal checkup. I mean,
Well, like
typically.
if 10, if 100 people were new patients for you in Awatuki,
Mhm.
what would the top reasons, the top three or
Mm,
five reasons of why somebody in Awatuki has been calling you and wanting to see you?
Probably hormones, um, gut health, and pain. Those would be the top three.
Hormones,
So
gut health, and pain.
yeah,
Wow. Hormones. So let's start
lots of hormones.
with hormones. Hormones, gut health,
Hmm.
and pain. So I got to tell you, a trend going on. I mean, now remember, my whole world's biased by old dentist, right? And now that I turned 59 this year, and all my dentist friends are about 60, and 30 years ago, we were getting married, then we were having kids, and now
Yeah.
it's grandkids. And I have several friends that are doing this anti-aging hormone therapy where
Hmm.
they're taking testosterone cream on their
Hmm.
arm, and they're taking a daily injection of human growth hormone, whatever.
Hmm.
But is that
Yeah,
what, when you say
HGH.
hormones, is that what you're talking about?
Yeah.
Anti-aging? Or
Well,
what?
I mean, I'm talking about hormonal imbalances. So obviously with age, our hormones become depleted and we can't make as many. And, especially I see a lot of men too who need testosterone therapy and things like that. Women going through menopause. And so we do a lot of bioidentical hormone replacement therapy. We can even treat most hormone disorders with herbs. I don't do a whole lot of like HGH, so human growth hormone, or HCG, for weight loss. There is, and that's just a personal preference. There's plenty of doctors who do that and they do it safely, but I'm just not well versed in that particular area. And there's conflicting research about, you just want to be careful with HGH. They might claim that it's, the anti-aging hormone, but it's a hormone that literally grows things. That's the human growth hormone. So you have to be careful if you're going to grow lots of things. Yeah, you're going to grow muscle and all the things you want to be grown, but what about cancer cells? What about glands that shouldn't be enlarged, like thyroid, or your heart can become enlarged? So you just have to be, hopefully your doctor is doing that with you and taking those measures to investigate, make sure that nothing else can be, that you're not setting yourself up for a bigger disaster than needs to be. But we do, in terms of anti-aging, hormones deplete with age, so we do a lot of hormone replacement. I think anti-aging for us is more of, on a cellular level. So we like to take care of the aging process with good nutrition, good lifestyle changes, IV therapy, things like that, which age us. If you don't have good diet or nutrition, that'll age you quicker, right?
Being a selfish man, you said that men come in for
Mm-hmm.
hormone therapy. I technically am a man. Why would a man need hormone therapy?
Well, unfortunately, testosterone in men, which is the main hormone, right, um, depletes with age. So every year that you're alive, you don't make as much testosterone. I mean, how I do see some really healthy guys in their, 45, age 50 with great levels, but most of the time after 30, I see guys coming in with lower levels, and that can be from stress. So your adrenal glands um, secrete testosterone, and when you're stressed, they have to over secrete cortisol and they become fatigued. So when you're stressed, you can't make as many hormones. So I see a lot of those patients, and we do testosterone therapy if I feel that's indicated. We do a lot of stress management. A lot of the times it could be handled with some IVs, IV nutrients. Maybe they're just nutrient depleted. So there's a lot of reasons we have to investigate why you're not able to make as much testosterone, right?
Yeah, and now answer the same question for a woman.
Yeah. So women have a few more hormones we have to look at, right? Including testosterone. So their testosterone levels can certainly be affected as well. But we've got estrogen, we've got progesterone to deal with as well. And they are on a cyclical basis, right? So every month, those levels change. And once they hit 45, 50, their ovaries will run out of eggs and the hormones are thrown off. So their cycle can't happen the same way it used to. And your adrenal glands, again, have to take over to make those hormones. And if they're fatigued, which all of us are chronically stressed and fatigued, and by the time that happens, it can't compensate and start making those hormones like they're supposed to. So we have to do stress management and adrenal fatigue treatments. And a lot of times they just benefit for a little bit extra hormones. So we can do some creams or an oral progesterone. And that's just enough for them to get their adrenals going again.
For people listening, if they want more information from you, should they go to phoenixantiagingclinic.com or should they go to drashleystein.com? What's the difference between those two?
Either one. My personal website is the Dr. Ashley Stein one. So that you can find me. That's where you can find me on my online teleconsults. I also work in Gilbert one or 2 days a week. So they can find about, to see what I'm doing, a little more about me and where they can find me, depending upon where they're located in the Valley. Phoenix Anti-Aging Clinic would be a good place to start, though, if you're already local. You want to come in, you want to see what therapies we're doing in our office here in Ahwatukee. And you can also schedule on both of those websites. So
everyone I've ever talked to that listens to the show does it on their hour commute work. I mean, they live in the foothills and they work downtown or whatever. Give them a visual of where your office is located so they can see it. If they live in Ahwatukee, they know it.
Okay. So we're on Ray. So if you know where the Target is, we're a little bit west of that. So do you know where Hobby Lobby is?
If you get off on I-10 on Ray, and now you're driving back towards the foothills to California. So you're driving down Ray, you pass Target.
And then there's Hobby Lobby, the other dangerous one. Yeah, we're right across from Hobby Lobby.
Across the street on the other side?
Across the little side street. So on the same side.
Same side. So you're still north of Ray Road.
We're basically next door. Yeah, we're next door, but there's a little street there so you can get in.
And if you go to phoenixantiagingclinic.com, you'll see services: thyroid, adrenal disorders, pain management, prolotherapy, IV therapy, vitamin injections, men's health, cancer care, second opinions, anxiety, depression. My gosh, I mean, that is I'm sure you're a busy person. Money's the answer. What's the question? People always want to know, do you take insurance?
We don't take insurance for the visit. We are a cash pay office. However, we can create a super bill for you to submit to insurance. If you have Cigna, I believe they cover some naturopathic visits, so you have to check on that. And then another option is we also can run your labs through insurance. So it's a yes/no answer.
And what would a new patient exam consultation, would you recommend that they do that telemedicine on your telemedicine portal, or would you recommend if they live in Ahwatukee to come on in, or what's the best new patient?
Yeah, I would say if they live in the Valley and they are close enough to drive, I always recommend to come in person, because then I can do more with them legally down the line. We have to establish care in person in Arizona, and then I can continue to see you via telemedicine. If you're out of state, which they're probably not listeners from out of state, that's where you do the teleconsult to begin with.
My gosh, it is amazing with the internet how you can just sit down and talk to someone like you, and people can enjoy it. Not just on the other side of the planet, but 100 years from now. There'll probably be some PhD person at ASU working on some history deal, and they'll say, you know what Ashley Stein said 100 years ago in Ahwatukee? Because I got to end on this. This is so the internet came out, right? It was like 94, and you had eBay and Amazon went public and all that stuff. And since I'm a complete geek weirdo, I got on eBay. So of course the first thing you look for when you get on eBay has got to be old dental books. And the father of dentistry in America is G.V. Black, who's a dentist before they had dental schools. And I was able to buy the first 3 books he wrote, autographed and signed.
Whoa.
And I don't want to tell you how much money I paid for it, because I still think $8,000 was way too much. But I was so excited to read this book of G.V. Black, the father of my profession. And he was talking about drilling holes above the teeth to let the trephination, to let the evil spirits out. And then he drew the evil spirits. And of course, they all look like court jesters with funny hats and wigs and bells. And I'm like, I just paid $8,000 to find out that guy was a quack, and then a quack, and then you realize that now I've been out of school 87 to 21, 34 years, and I just can't believe the stuff that's not just changed in dentistry in the last 34 years or the last 134 years, but even in physics, even in astronomy. I mean, they are just there are major breakthroughs. I was reading a deal the other night. I love our next door galaxy, you know, Andromeda or whatever they call it. And my gosh, they just found something out about that thing that just changed their whole view on the whole galaxy. And it'll be so exciting. I tell my grandkids all the time, I said, now remember when Grandpa got out of school, there was no cell phone, no computer, you know, because one of my grandkids was crying about he wants an iPad or a new iPad. And I said, now you know when I got out of dental school, that didn't even exist. So why are you crying about an iPhone and an iPad when Grandpa was... I had children before that was an invention. I mean, looking back at my childhood, the greatest invention ever was the automatic garage door opener. Because whenever we pulled up to the driveway, my mom always made me get out and lift up the door.
It's the little things. Yeah,
oh my God. And when we got that and you push that button and that big 1,000-pound wooden door went up, I thought, and then the next thing that was great, it was the remote control, because when I grew up, I was the remote control. My dad would say, how do we go change it to 5? No, go back to 10. And then if it was bad weather, I had to stand there holding the rabbit ears because it grounded it. And it's like, oh, glad to be alive. I get to ground the TV antenna. And now people are just watching all that stuff at work.
They don't even know what antennas are.
Yeah.
They're gone.
But all I want to suggest to our listeners is that, you know, you can go your whole life. I mean, I even hear dentists, you know, 30 years after graduation saying, well, how come in dental school they didn't teach us? I mean, if you want to go your whole life blaming your dental school for not teaching you, your parents or whatever, you know, the word doctor comes from the Latin word docere, meaning to teach. And the greatest doctor on earth is not me or Ashley. It's you. It's you becoming a self-master of your own life, and it's you putting in the work. It's you reading, and that little birdie on your shoulder, that intuition, like it happens to me every time I walk in the kitchen. It's like, I know I'm not supposed to eat that. So you can't blame everything on I know a lot of people want to talk about healthcare, and healthcare should be free. Well, why are you going to take $100,000 of my taxes to pay for your lung cancer when you paid $9 a pack every day for 40 years, and insurance didn't pay for that? But now you want me, and I think a lot of this insurance is in economics. I got my MBA at ASU, and it's funny how everything they taught me in ASU MBA goes against insurance. I mean, it's a bad incentive. Like if you ate chocolate and drank Coke every day and had 9 cavities, well, you wouldn't want those to be free, because how would it change? In fact, you would want them to be as expensive as possible. And that is why the entire country of China, which I've lectured at in China, they don't have dental insurance, because they mathematically have concluded that, well, that's absolutely the wrong direction. And my gosh, you want to, if you stick your finger in a light socket and it feels good, you'll do it every day. If you stick it in a suction, they go, no, we don't want to. They say, why should your employer or your country subsidize your decision to eat sugar, not brush, not floss? And why would this guy have to take the profits he made from his own working means of production to subsidize Mr. Coca-Cola chocolate eater over here that wants to have free fillings? And you don't have that in economics. And then when you suggest, like, well, maybe I've seen studies like this where they'll say, okay, well, we're not going to cover you know, a hip transplant, you know, or a knee or anything. We're going to make you have a 10% copayment. It's like 40% of the patients say, well, it's a $50,000 knee, and I got to come up with 5. Forget it. I'm not even going to do it. And it's like, wow, well, you didn't think like that when all the other taxpayers on your block were supposed to pay for that $50,000. When you just had to pay $5,000, You said hell no. But then you expect everyone else down the street to pay for the whole thing. So the whole thing, that this isn't a lecture, this isn't a sermon, this and that. All I'm saying is that, you know, dude, it only matters to you. You're the one that's going to live with all the consequences. And traditional medicine is, you say, I don't sleep very good. Here's a sleeping pill. And one of my very good friends was on Ambien for sleeping, and he woke up in the middle of the night in a dream and drove to his dental office and crashed and died.
Oh my gosh.
So maybe taking the Ambien wasn't as easy as you thought. And maybe, you know, maybe it's your life, it's your body. But you know what? If you're told you got to have some invasive surgery and take a pharmaceutical pill, I'm sure the pharmaceuticals companies would love the profits. But I think maybe you should see if there's a natural alternative. And on that note, Ashley, I know you're busier than a one-armed dentist. Thank you so much for taking the time out of your schedule to come on my show. It was a complete honor, and I hope one day you can, as soon as you figure out how to naturally grow hair back. My God, I can walk to your office. I'll just walk.
We have some options. Come on over.
Well, you got 2 feet of hair. Can't you just spare like at 1 inch?
Yes, I'd be happy to donate to the cause.
Okay. All right. Well, have a great day.
Thanks for having me, Howard. Great to meet you.